Emotional brain uses a personalized medicine approach because everyone is different. A particular disorder may have different underlying causes and symptoms in different people. Aspects such as genetic profiles, physical characteristics, and hormone levels form an important foundation. However, the influence of biology on the body must always be examined in conjunction with the environment. For example, how does someone respond to social influences such as upbringing and relationships? This interplay is important when it comes to understanding certain disorders. If you have a better understanding of the disorder and its cause, you can develop the best treatment: psychological treatment, drug treatment, or a combination of the two. Emotional Brain has developed a personalized approach for the diagnosis and treatment of women who are experiencing reduced sexual desire. Sexuality is an important part of life. It is essential for reproduction, but also leads to relaxation and pleasure, and is important in an intimate, loving relationship. Sexuality issues can cause problems for yourself as well as in your relationship. In this case, it may be sensible to consult a psychologist or doctor. He or she will try to establish the cause of the problems. This might be your relationship or any prescription drugs you are taking, or female sexual interest arousal disorder. FSIAD may be diagnosed. This is a disorder which affects sexual interest and arousal. The diagnosis is described in the DSM-5, the Diagnostic Manual for Psychiatrists and Psychologists. It has the following characteristics. The disorder is diagnosed if the woman in question experiences 3 of these symptoms, and the complaints last for a minimum of 6 months. This means that sexual disorders resulting from a bad relationship, a poor lover, drug use, or an illness do not fall under the diagnosis of FSIAD. Reduced sexual desire can have at least 2 underlying causes. In some women, the brain is relatively insensitive to sexual stimuli. For example, the partner's sexual advances are not recognized as important and interesting stimuli in the brains of these women, as a result of which they do not lead or rarely lead to a desire for sex. Another cause of reduced sexual desire is an overactive inhibition system in the brain in response to sexual stimuli. This is often caused by previous negative sexual experiences. These women have a system which is sensitive to sexual stimuli, but as soon as a stimulus is experienced, an automatic inhibition occurs, as a result of which the sexual response is insufficient or absent. Emotional Brain is developing different medical treatments for both underlying causes of FSIAD. For women who are relatively insensitive to sexual stimuli, we have developed Lybrido. For women with an overactive inhibition system, we have developed Lybridos. Both groups have the same symptoms and therefore look the same. Using a personalized approach, Emotional Brain has developed a method of distinguishing between these 2 types of women on the basis of psychological, hormonal, physical, and genetic characteristics. This approach will be further developed into a useful instrument, which makes it easy for doctors to determine which drug is required: Lybrido or Lybridos. With this personalized approach, Emotional Brain is well on the way to finding a solution for a very common but silent problem.